Good afternoon, everyone. Today's session is going to be really helpful and it is led by Dr. Nivedita Jha from Apollo Cradle and Children's Hospital. So stick around to talk about heavy menstrual bleeding and everything you should know about it. If you have any questions during the webinar or any questions, you can write in the comment section or you can ask us. Doctor, you have the stage now.
So, good afternoon, all. Today, a very important topic for all the women, whether it is a young age girl or a teenage girl or the reproductive age, as we say. So, first of all, big namaskar from me. I'm Dr. Nivedita Jha. I'm a consultant obstetrician and gynecologist in Apollo Cradle, Kormangla. So, I will start with the basics of heavy menstrual bleeding. Heavy menstrual bleeding, or as we say, heavy periods, or in the medical terminologies, we say menorrhagia, is a very common condition. In fact, one third of women in India suffer from heavy periods or heavy menstrual bleeding once in their lifetime. Some women don't come forward because they think it is normal to bleed like this. So I'm gonna bust some myths also towards the problem in this session. First of all, what is heavy menstrual bleeding? In simple terms, any menstrual bleeding or any bleeding in the period which is affecting the woman in doing the day to day activities, which is restricting her to achieve the full potential to perform. But there are particular criteria where we make the diagnosis when the women come to us. So, if the periods are continuing for more than 7 days, that is the first criteria. If you have to use a tampon or a pad and you are changing it every hourly for few hours together, or you have to change your pad or tampon in the night, or you're using two pads and a pad or a tampon together during your periods, or the soakage is so much that the spillage is outside, say for example outside the clothes that you're wearing, or during your periods you feel extremely tired or extreme fatigue comes upon you. These are few of the criteria which should bring you to your obstetrician and gynecologist. Secondly, how common it is in India. So there is a terminology called abnormal uterine bleeding, which includes all the patterns of abnormal periods that you can have. And heavy bleeding during periods constitutes around 70% of abnormal bleeding. The other causes can be bleeding between the periods or painful periods or not getting your periods, that is delayed periods. But the most common reason of abnormal uterine bleeding is heavy bleeding. Now, coming to why you should come to your doctor. So, there are two answers to it. First thing, bleeding heavily is not normal. There is a cause. I will talk about the causes a bit later on. So, first thing you should know why you are bleeding heavier than usual. Is everything okay inside with the uterus, the ovary, and overall health? Secondly, if women continue to bleed heavily, they develop iron deficiency anemia. Iron deficiency anemia can make women very tired, and then it can have bad effects on overall health and heart. Now, when you come to the hospital, before that, I will just give you a brief of what all can cause abnormal bleeding or heavy bleeding during the periods. Heavy bleeding, say for example, for an adolescent, it can be because of the hormonal imbalance or lack of ovulation, or what is called as anovulation. Anovulation is the inability to release an egg in a cycle every month. Now, this is very common when the girls start to menstruate or towards the end when we what is called as a perimenopausal transition, when the ovulation does not happen every month. So, firstly, it can happen because of anovulation. I'll give you an example. For example, a girl or a woman who has not bled for 6 months and she gets her period and then she is bleeding heavily. So, this is an example of anovulation. Second reason of heavy bleeding can be the problems in the uterus. The most common problems in the uterus which can cause heavy bleeding are fibroids of the uterus. Now, what are fibroid uterus? Fibroid uterus are tumors which arise from the wall of the uterus, but they are benign tumor and very rarely they can convert into cancer. But that risk is very low. But these fibroids, if they are impinging on the inner lining of the uterus, which is called as endometrium, or they are big, they can cause very heavy periods. The second reason can be the inner lining of the uterus becoming very thick, thicker than usual, what is called as hyperplasia of the endometrium. That also happens because of increased estrogen in the body, which is called as hyperestrogenism. And the risk factors of that is a family history, increased body mass index, increase in weight suddenly, sedentary lifestyle. The other reason in the uterus which can cause heavy bleeding is called endometrial polyp. Now, when the endometrium is becoming thicker than usual, at one point of time, they become bulged from the surface of the uterus or from the inner lining of the uterus, and then it is termed as endometrial polyp. Third reason can be if you're using some form of contraception, especially uh, oral contraception, combined birth control pills, as we say. And if you are not using it correctly, or if you have missed your periods, that can also cause heavy bleeding. The fourth reason is very common, which in our practice we encounter every day, is called endometriosis, or sometimes which is also termed as adenomyosis. Now, what is endometriosis? Endometriosis is the presence of inner lining of the womb or the uterus to a location which is not meant for it. So, when the inner lining of the uterus goes and sits at the top of the ovary, it can form a chocolate cyst. When it goes inside the wall of the uterus, it is termed as adenomyosis. This is the fifth reason. So, likewise, you have different reasons, and to understand why you are bleeding heavily, you need to contact your healthcare provider, your obstetrician, and gynecologist. Now, when you go to your obstetrician, the most important thing that they do is the history taking, because there are certain conditions, especially because I have not talked about the cancer of the uterus or the genital tract, which can also cause heavy menstrual bleeding. So when they take when they take the history, your doctor will ask you about the symptoms, about associated pain, about the pattern. She might also want to look into the pattern of the bleeding, the details of how many days you bleed, how many days it is heavy, have you ever taken any treatment for that, any personal history of any medicines which can cause heavy menstrual bleeding, or if you have a personal history of any bleeding or clotting disorder, or if you have a family history. For example, we have seen that women who have family history of polycystic ovary, who have family history of fibroid or endometriosis, they are at high risk of developing these conditions themselves. And thirdly is the family history of cancer of endometrium, ovary, breast in the first degree relatives. After the history, the physical examination is done by the gynecologist. In the physical examination, in the abdominal examination, if the uterus is palpable, or if we feel that there is a mass or a lump which seems to be arising from the pelvis, that is also an indication to send the patient for a abdominal scan or a transvaginal scan depending on the history and the examination. Thirdly is the local examination, or what we called as a per speculum examination, to rule out the local causes, especially the infections which can sometimes cause heavy bleeding, the pelvic inflammatory disease, as we say, or some cervical problems. The cervix is the neck of the womb, and sometimes when you have any polyp or any erosion, as we say, where the cervix is raw, that also can cause problems like bleeding after intercourse. Not necessarily heavy bleeding, but abnormal pattern of bleeding. After the examination, the doctor will ask to go for initially the ultrasound scan to rule out whether the uterus, ovaries, all over inside of the abdomen and the genital organs are normal or no. The other test that we do is called as a pap smear. I think most of you would have heard the name. It is a very important test, and every woman who is sexually active and more than 24 years of age must do it uh, for the prevention of cervical cancer. Cervical cancer is the second most common cancer in India. But unfortunately, even though the screening test, that is the pap smear, is available freely, only 2% of Indian women have been screened according to WHO in 2019. A report had been released. So, whenever you go to your gynecologist next, whether it is for heavy menstrual bleeding or for some other reason, I think it is a good idea to ask about pap smear because it prevents cancer. It detects the stages much before cancer, and the steps can be taken towards it. So, the gynecologist will examine you, do a pap smear, send you for an ultrasound scan, and there are few blood tests that may be asked for you. Say, for example, full blood count to check for the hemoglobin level, because the main problem with heavy menstrual bleeding is low hemoglobin and the iron deficiency anemia, and that is why women feel tired and fatigued. Thyroid hormone testing and other testing for bleeding and clotting disorders are done only for a specific subgroup of the women in whom we suspect that the heavy bleeding is caused by the thyroid abnormality or bleeding disorder. To give you an example, if a woman or a girl has been bleeding very heavily since the time they started having their periods, then we test them for something called as von Willebrand disease. Von Willebrand disease is a genetic condition in which there is a dysfunction in the way the platelets should stick to each other, and that is why these women bleed more. Secondly, if you have a family history of any bleeding or clotting disorder, then we ask for bleeding and clotting disorder tests. Secondly, if we have other features of thyroid imbalance like weight gain, hair loss, constipation, dry skin, then we ask for thyroid test. Depending on the patient and the characteristics of the patient, different blood tests can be asked. A very important investigation in heavy menstrual bleeding is ultrasound scan. Ultrasound scan of the abdomen, and sometimes we ask only for a transvaginal ultrasonography. Now, why do we ask for a transvaginal ultrasonography? Because there are few conditions, as I discussed adenomyosis, which can be diagnosed with such good sensitivity and specificity by transvaginal ultrasound scan that even the MRI can't detect those changes. So, transvaginal ultrasonography is a very important investigation. Thirdly, there is something called as hysteroscopy, in which a very thin camera is inserted into the vagina and inside the uterine cavity to see whether the uterine cavity and the inner lining of the uterus or the womb is normal or no. This has certain indications. Whenever we are suspecting that there is a fibroid which is inside the cavity of the uterus, or as I explained earlier, when we are suspecting that there is a polyp or there is thickening of the lining of the uterus, or where we are suspecting there can be a pathology in the inner lining of the uterus. For example, there is a woman who has irregular and prolonged cycles and plus heavy periods, or a woman who has tried everything, all the medical management has failed, but still she suffers from heavy bleeding, or we have a family history of endometrial cancer, we have obesity on board, or PCOS. So these are the conditions in which we suspect that endometrium can have problem, and then we do hysteroscopy, that camera, small camera which is inserted inside the uterus, and then we do the biopsy of the inner lining of the uterus and we send it to the lab, and from there our pathologist will let us know whether the cells are looking normal, abnormal, or in between somewhere. Depending on that, the treatment of the patient will be carried out. Now, coming to the management, the first important thing that we talked about, the main cause is anovulation, the inability of the ovary to release egg every month, which is called as anovulation. Now, anovulatory cycles are found in women who are overweight or obese, and also because of the lifestyle changes. So, the first thing that women can do when they are having heavy menstrual bleeding, delayed period, prolonged period, is change their lifestyle. Now, when I say change their lifestyle, what I mean to say is regular physical activity. At least 5 days, 45 minutes of moderate intensity exercise, or changing the diet, the way you eat. Green leafy vegetables, fruits, stopping smoking, or other uh, substance abuse. That is very important. So, the first management is the lifestyle changes. Second, there are so many medical management, medical medicines available. To name few of them, we have something called as tranexamic acid, which is a non-hormonal medication which can be given to the women who are bleeding heavily, and then it has to be taken only during the periods. So if you are bleeding heavily, you can take the pill and the bleeding will be under control. The second option is called as NSAIDs. NSAIDs like mefenamic acid or ibuprofen, which is also known to reduce the bleeding during the periods in a woman who is bleeding heavily. Second set of medications are the hormones. Hormones can be a combined oral contraceptive pill which contains estrogen and progesterone, or it can be a plain progesterone tablet. Depending on your situation and the risk factors and the hemoglobin level, the gynecologist will decide which treatment suits you the best. If the hormones are taken only for a limited period of time, say for example 3 to 6 months, there is not major side effects that we expect from the hormones. The third management plan can be putting something called as levonorgestrel intrauterine device, or in common terms we say Mirena. Now Mirena is a T-shaped device made of plastic, and it contains 52 milligram of levonorgestrel. It is an intrauterine device. So for women who bleed heavily and they have fibroids less than 3 centimeter in size, or they don't have any abnormality found in the ultrasound scan, they can easily use Mirena for the management of heavy menstrual bleeding. Mirena releases minute quantities of hormones inside the uterus and manages the hemoglobin level, manages the heavy menstrual bleeding very well. In several randomized controlled trials, Mirena has been found to be effective in 80% of women in having heavy menstrual bleeding. The problem with Mirena is that for the initial 6 months of the insertion of the Mirena, you can see on and off or irregular spotting or bleeding, which can be discomforting to women. But once it settles inside the body, it is a very good device because it can be kept for next 5 to 7 years. This is the second line. The third line, if the medications have not worked or if the Mirena has not worked, the heavy bleeding continues, the fibroids are big, then we go to the second step. The second step includes endometrial ablation, which is a surgical technique which, with several different energy sources, it tries to destroy the inner lining of the uterus. Then we have uterine artery embolization, in which radiologically we go inside the uterine artery and then we block them with embolic agents. If the fibroids are bigger than 3 centimeter, heavy menstrual bleeding is not settling down, uterine artery embolization is also an option, but it requires specialized center and interventional radiologists to deal with it. After all of this, if uterine artery embolization and endometrial ablation also has failed to cure the symptom, then the surgical techniques like myomectomy, that is the removal of the fibroid if the heavy menstrual bleeding is caused by the fibroid, or hysterectomy, which is the removal of the uterus, can be done to cure heavy menstrual bleeding. Myomectomy or hysterectomy can be done by a keyhole surgery, which is called as laparoscopy. But the route and method of the surgery will be decided by your gynecologist when you visit them, depending on the size of the fibroid and depending on the size of the uterus. These surgeries, if they are performed with precision and in skilled hands, the complication rates are very less. And hysterectomy, whenever it is done for heavy menstrual bleeding, the ovaries in most of the time are conserved because these women are young. So the sudden onset of menopause, that is stoppage of the periods, don't happen. So if a surgery is required, it is not a major complicating surgery, and if your ovaries are going to be retained, then it is not going to cause a problem in the long term as well. So I think the message would be, if you are suffering from heavy menstrual bleeding, then don't suffer in silence. Go and meet your gynecologist. There are very good options available, as I explained, and there is a stepwise protocol for the treatment of the heavy menstrual bleeding, which starts from the medicines and then goes to Mirena and then other options. And because if you leave it alone, it can start affecting the overall physical as well as mental health. I'll be happy to take any questions if there are any. So I'll just end this session by just telling that heavy menstrual bleeding is very common, but all of you, all the women, please don't ignore your symptom because don't make it big. We have seen women in our practice coming to us with a hemoglobin of sometimes 3 or 4 gram when the normal value for a woman is around 12 to 13 gram. So do not suffer. Come to the gynecologist. They'll help you with physical examination, investigation and the proper treatment. Thank you.